Good afternoon, Board of Directors, Madam Chair. Hopefully you're having a great day. As organizational leaders, our mission is to ensure the organizational goals are achieved each year. These goals entail both the quality of care delivered and the quantity of dollars acquired to sustain our operations and deliver this care. Last summer, in 2010, in preparing for the 2011 fiscal year, we anticipated a decrease in overall productivity due to the main center's planned renovation. Also, in our preparation, we anticipated occurrences that would affect our bottom line. However, unanticipated events do occur in which we have to make adjustments and make the missions that seem impossible possible. As we are currently in the fall of 2010, there is a problem recognition. Due to the renovation and unplanned closing of the main center in December of 2010 and January of 2011, there will be a significant reduction of access to health care for the patients in the first quarter of 2011. Oakhurst Medical Centers, as you know, serves a large community of DeKalb County in Georgia, especially the adult and children immigrant population. As a result of a needs analysis, it was determined that a renovation expansion of the main facility would accommodate an additional 20% of this community. Expanding and providing quality health care to our community is one of the goals of Oakhurst Medical Centers. During the stages of the renovation, it was recognized that the workflow of operations would need to be altered. Renovation phases would entail a reduction of workspace, particularly in the clinical areas in which we could not evaluate patients as quickly due to reduction in exam rooms. The renovation was planned to transpire over a period of 4 to 6 months. During the second month of the renovation, however, environmental hazards were identified and the main center was forced to close for nearly 7 weeks. The unanticipated closing reduced access to care for the patient population that was served by the main center. So we do have a problem as recognized, and our problem statement is, given the renovation and the subsequent unplanned closing of the main center, the following will result. Number one, there will be a decreased number of patient users and encounters in the first quarter of operations of 2011. The budgeted encounter goals for 2011 will not be achieved. There will be reduced access to care for the patient population served by the main center. So the assumptions. Nearly 1 year prior to the planned renovation, both the Chief Financial Officer and I, the Chief Medical Officer, had a meeting and planned the 2011 fiscal year budget, factoring in a calculated reduction in the encounter numbers due to the renovation. The calculation was based on a renovation process of 6 months with a monthly encounter reduction of approximately 20% each month. With the unplanned closing of the main center for approximately 7 weeks, both budgetary adjustments and alternative provisions for health care for the affected population needed to be implemented. So what were our alternative solutions? So tentative alternative solutions. Number one, scheduling patients of the main center at our one existing satellite center. Number two, Accelerate plans to open the new satellite center earlier to accommodate these patients. Number 3, expedite plans to expand clinical services at the one existing satellite center. These tentative alternative solutions are outlined given the unplanned closing of the main center due to the hazards related to the renovation. Prior plans to continue clinical operation during the renovations now have to be altered. Now let's evaluate our alternative solutions and which one is possible. Number 1, scheduling our patients of the main center at the one existing satellite center. The satellite center is 1/3 the size of the main center. Therefore, the satellite center would only be able to accommodate up to 1/3 of the main center's volume, and that's being aggressive with that calculation. However, if the hours of operation of the satellite center are expanded each day by 4 hours, giving us operational hours of Monday through Friday, 8 a.m. to 9 p.m., and a Saturday morning clinic from 10 a.m. to 2 p.m. is added, another 20 to 25% of the main center's patient population can be medically served. Second alternative solution, accelerate plans to open the new satellite earlier to accommodate the patients. Plans to open the second satellite center have been implemented. The projected time for it to open is the second quarter of 2011. If these plans were accelerated to permit opening in the first quarter of 2011, an additional percentage of the main center's patients could be accommodated. This is in addition to those who are accommodated at the existing satellite center. The third alternative solution is expedite plans to expand clinical services at the existing satellite center. The existing satellite center has a capacity to be expanded by 3 exam rooms. The clinical support and support staff for this expansion exists currently, since the staff would be shifted from the main center to work during the closing of the main center. Now let's select the best alternative solution based on specified items. I feel that the best alternative solution would be, scheduling patients of the main center at the satellite center. This is the best alternative for the following reasons. Number 1, the option, although will not serve 100% of the main center's population, it can serve up to 50% of the main center's population. This will require operational hours, as mentioned before, Monday through Friday, 8 a.m. to 9 a.m., and 10 a.m. to 2 p.m. on Saturday. The feasibility of implementing this option in a short time frame is excellent. The cost-benefit analysis is good. There will be minimal additional costs to implement this alternative, since both the space and necessary staff is currently in place. The minimal additional costs would include adding additional telephone lines for the front office staff. Other resources, such as medical equipment, office supplies, can simply be transferred from the main center during this time of operation. Alternative solutions number 2 and 3, which included accelerating plans to open the new satellite center from the second quarter to the first quarter of 2011, and the third plan to expedite plans to expand the clinical services at the existing satellite center by expanding the space, is not immediately feasible. These 2 alternatives would require months to implement and would require additional unbudgeted cost. So implementing the solution, the best alternative solution with your support, requires the following. rescheduling of the main center's patients to the satellite center. The priority patients who would be scheduled are those patients for preventive services and those patients who require sick visits. Number 2, arranging for the transfer to the satellite center of necessary additional resources such as medical supplies, medical equipment, and office supplies. Number 3, arranging the necessary adjustments in order that functions of the finance department would remain uninterrupted, particularly and namely the revenue cycle. Number 4, rearranging provider schedules to include expanded clinical coverage for days, evenings, and weekends. This implementation will require a collaborative effort between the front office manager, the director of nursing, the chief financial officer, and myself, the chief medical officer. So let's fast forward to a new board meeting in the summer of 2011. The board of directors did support the best alternative solution. So in evaluating those results. Good afternoon, board of directors. Welcome to our August meeting of 2011. Let's review evaluating some of the results of our selected best alternative solution regarding implementation of accommodating patients who were displaced from the main center due to the unplanned closing of the main center. Number 1, as you know, the main center was closed during December of 2010 and nearly the entire month of January of 2011. For January of 2011, the monthly budget encounter number was 2,828 and 1,348 encounters were achieved. This 1,348 represents nearly 48% of the budgeted encounter number. Had we not made the shift to accommodating the patients at the one satellite center, this percentage would have been much lower. Number 3, the budgeted encounters numbers from January of 2011 to June of 2011 was 16,968 and 15,883 were achieved. This represents now 94% of the budgeted encounter number. Number 4, the second satellite center and the expansion of the primary clinical services at the existing satellite center occurred in July of 2011. With the opening of the second satellite center and the expansion of the primary clinical services at the existing satellite centers, we were able to move closer to our budgeted 2011 encounter goals. I'm happy to report, as of August 31st of 2011, Oakhurst Medical Center encounter number is now 99% of the budgeted encountered number year to date. So it seemed at first with the unanticipated or unplanned closing of the main center due to the environmental hazards identified at the main center that our budgeted 2011 goal was not going to be achieved. However, we implemented the necessary steps, choosing the best alternative solution with the support of the board of directors. And we're moving closer to achieving our 2011 budgeted goals. The seemingly impossible, that is, not achieving our projected budgetary goals for its fiscal year 2011, are now being made possible. Thank you for your support.